Hey everyone, I'm Dr. Sebastian Gonzalez, and this is the Performance Play Sports Care YouTube channel. We're going into today some reasons why you might not want to stretch your hamstring. And I'm going to go over one test called Slump Test, which is a really good one to see if actually your hamstring tightness, quote unquote, is actually from neural tension. Neural tension is a condition where you mainly have, I guess you would say, an entrapped nerve, or a nerve is not moving. Or there's other conditions of the spinal column or cord which you might want to address a different way than stretching the hamstring. So I'll show you the test, and for the most part, I'll try to make this really easy for everybody. By the way, if you're thinking there's going to be corrections to this in this video, there won't be. This one's a purely educational one on this test, and we'll show you the reason why we actually do it and how we formulate treatment plans around it if it's positive. So Slump Test is typically if someone comes in and they say they have hamstring tightness, or they have back pain, or there's sensations down into the thigh. Oftentimes it's really harder for them to differentiate between neural tension and hamstring tightness. So what we typically have them do is go like this. They might feel it light up a little bit down here. Say we're talking about the right side. But as soon as you tuck their chin and you keep everything else constant, okay? The hamstring's not moving any more than it was. As soon as they go like this, sometimes it just lights them up and they got to stop. So that's a positive slumps test. A negative one would be the neck wouldn't really have any effect whatsoever. And in that case, you still could be having an issue with the hamstring, or it could still be some other issues down there as well. But what happens there in that test, and I'll show you on this model actually first. So these little nerve roots right here, the yellow ones, they have skin on it almost. And there's also the spinal cord in the middle, which has the same kind of skin on it. It's all continuous amongst each other. These nerves form larger nerves which go down. But for the most part, when we bring this leg forward, we're pulling the skin of it down this way, okay? And as soon as you tuck the chin forward and keep that constant, it's basically stretching it from both ends, and it just pisses it off. So when you probably looked up things like nerve flossing techniques, and my standpoint on nerve flossing is it's not a bad thing, but I think it can be done in a bad way. So personally, I feel like if this was, say, the nerve, and we want to have slack on one side, say this is where it's stuck, and this is the side we want to pull it through with. Let's just say we're pulling it with the leg or the hamstring. So you pull it through like this, and if there's slack on the other end, it'll move through the area where the entrapment is. And the entrapment could be at the spine, it could be within the muscles down here, it could be through a lot of different parts, and I'm not going to specify what we're talking about in that regard because that's very case specific. So again, if it's slack on the other side and you tension it, it'll pull through with it. But let's say I step on that one, and now I'm trying to pull like this. This basically just has the potential of ripping the thing in half. And although you won't rip the nerve in half, you'll really, really irritate it. So when I pull the neck and the leg is constant, it doesn't do you any favors. So proper nerve flossing should be done where there's slack on one end or the other, okay? So the way we typically try to use this as a test to design rehab is that if we have an actual hamstring condition, we're going to give you hamstring specific things. We'll also give a lot of core and pelvis specific things, but if this is a neural traction type of injury, or there's nerve tension, then we have to figure out whether there's things within the spine first that are creating that compression on that nerve. It could be a disc injury, which would be like right here. It could also be that this hole that the nerve is coming through, that this yellow thing's coming through, is getting smaller. It could be getting smaller from the bone surrounding it, or it could be because the nerve or the disc is pushing into it, or it could be because something's growing there, which would be like a tumor, a cyst, something of that nature. Or you can have injuries of the facets and little joints in the back as well. So there's many different reasons why. And as you can guess, if there was a cyst or a tumor, we would have a very different remedy than if it was a disc injury. So this is how we kind of formulate treatment plans around tests like this, and this is why tests like this are really significant and useful to a practitioner like us, and this is how we can help you. So if you have questions about this test, put them below. I have no problems answering them. But if you have a specific question for me, you can also go onto the podcast as well. You can go to pt sportscare.com/podcast, and there's a way to put your voicemail on there, so I'll answer it on the podcast as well. And you can also get your voice featured right on the podcast. So share this with as many people as you can who have leg and hamstring tightness. Talk to you guys soon.